I'm just making sure you can hear me okay. I hope that's okay. First off, thanks for having me and being able to participate in this really interesting webinar. I should start by saying that I am not an expert at all in evaluation. In fact, I'm going to be speaking very specifically about the work that we're doing. Our Indigenous Health Research Group is part of a cost-funded second phase project with the CACO group, and I'm not sure if all these acronyms are too much to start with, but CLASP is a Coalition Linking Action and Science for Prevention grant, which is funded by the Canadian Partnership Against Cancer, and we're part of the second phase. It's called the Collaborative Action Against Childhood Obesity, and CDPAC is actually the principal organization on it. Our Indigenous Health Research Group is working specifically with Indigenous communities in our 9 partner communities. And really today, I just wanted to, in this very short presentation, speak to you a little bit about some of the challenges and learning that we've experienced in terms of trying to do rigorous evaluation, in part for our own purposes in terms of our commitment to the communities that we're working with, but also in terms of the funding agency who's providing us the funds. I mean, we have an obligation there, and we're trying to satisfy all. It's been an interesting kind of journey for us over the past 4 years or so, and so that's what I'm going to be speaking to. So I guess if we can move to the next slide, Bill, if that's okay. I'll give you just an outline of what I'll be talking about. I'll explain a little bit about the project so that you can understand a bit of where we're working and what we're trying to achieve. My evaluation component, which isn't intended to sound like it's a critique on all the very excellent work that people who are evaluation specialists are providing, but really trying to show how when we try to implement some of these things, they're not always that effective and how we've had to adapt them. And so talk about the adaptive evaluation measures we are doing. And if we have time by the end of it, which we'll see, I can speak to a little bit about some of the preliminary results. So we can go to the next slide. So this project that we're working on, as I mentioned, this is phase 2 of this CACO project. And initially, our group has been working almost 10 years now in northwestern Ontario. If you look to the image on the map, and we've been working very specifically with OG Cree communities in northwestern Ontario. And they're very remote, blind communities, no road access, very small communities, working on basically chronic disease prevention projects through the idea of working with communities to develop local food strategies to improve food access and food quality. It's basically part of the larger food sovereignty initiative that our Indigenous Health Research Group has been committed to over the past few years. In the second phase of funding in CACO 2 for this project, one of the grant obligations was to expand in terms of outside of your jurisdiction and basically kind of expand the reach and, make the project a bit more, have a greater impact across the country. And so we were able to develop partnerships over the past few years with 9 different communities across the country. So we work up in Northwest Territories, up in Yukon, and in British Columbia. And as exciting as all that is, it's also extremely difficult in terms of, especially our approach. We develop very strong relationships with the communities in Ontario. And then to try to develop that type of trust and relationships with communities across the country, it's obviously much different. It's very expensive in terms of the amount of commitment, in terms of getting into communities and doing due diligence in terms of our time there, but also in terms of expanding the project. So we now work with the idea, our primary focus is on kind of land-based food strategies as a local food strategy. But we also have been working with kind of physical activity components, nutrition literacy, and also a mental health component. So you can see in this, I don't know, sure, hopefully you can see it clear enough, but basically the different communities are involved in different capacities. So some are focusing more specifically on the land-based food practices. Others are doing a host of the activities connecting to land-based healing programs, nutrition literacy, and physical activities. So what's been very unique about this project and something that's been quite exciting for us and we're very grateful for with CPAC funding it has been the approach, which has really been each community that has been participating with us, these 9 communities, it was up to them ultimately to define their own type of food strategy and how they wanted to involve themselves in this project. So each of the communities are ultimately tasked with the project objectives, and basically how they're going about their own strategy to improve food access and to basically improve health in their communities. So that is in kind of a nutshell. I was going to see I'm already quickly, have to go a little bit quicker. So if we go to the next slide in terms of evaluation. One of the unique things about this project was, even though we have this general kind of purpose about, again, trying to deal with, increasing food access and food quality and working with communities on local food strategies, each of the objectives and each of the plans are very unique. So in some communities, they're doing more on the community garden side. Some are doing more on really just trying to build more food procurement. So getting on the land, bringing food in, food distribution initiatives. Some are focusing more on really on an intergenerational approach to simply teaching kids about how to get onto the land so that they can basically build more sustainability around that. So it's not just a few people, but the community as a whole is actually learning, again, about how to acquire foods that are locally available to them. And so when we started doing the evaluation, we found it really daunting because it's not like just one thing that we're trying to work on. So we really have to go back and visit with the communities and think about, what are the evaluation objectives? Because they weren't necessarily aligned with what the communities wanted and what they were actually trying to achieve. So that was the first thing that we really learned from this so far. And the second thing was the evaluation tools and methods. They're not always that effective, especially in communities where they're not overly technologically savvy, don't have access to a lot of different types of internet technologies or a lot of different web-based things. And it's funny, one of the conversations just recently we had, so we were trying to organize a teleconference, and so Bill had sent us a doodle poll, which we were all filling in, but no one in the communities was filling them in. And so when I followed up through a Facebook chat with one of the community members about, did you fill in the doodle poll? And the response was, what's a doodle poll? So it really kind of shows where we are in terms of how, especially in very urban kind of centers, how I think we do a lot of planning and how we expect things to come about. A lot of these things that we take for granted here are certainly not the case in some of the communities. And the other thing, the third thing, was this purpose of evaluation. And again, I think it was brought up in even the first two presenters talking about, it's very time consuming and onerous and trying to get people to go about this. It's a lot of work. And so from the community's perspective, who are generally overburdened already with so many different work-related things and all these different issues about being very busy, and which is, we usually tap ourselves into the busiest people, it seems, in the community, they're not really oftentimes getting why we're doing the evaluation. It's like, why are we doing this? And if there's not any type of meaningful engagement in that, again, the amount of information you're going to get back is quite limited. So if we go to the next slide, we basically then started, especially in the second phase of CACO, we really started, we kind of started over really with all the communities and went back to them and really said to them, what are the things that you want to have evaluated? What are the objectives? What are the things overall that you want to see? And if you can let us know very clearly, it would be much easier for us to build an evaluation strategy to do that. And so that was the first step. The second, obviously, was then how are we going to do it in terms of evaluation strategies? I mean, there are many types of evaluation, whether we talk about goals-free or, there's a long list of them. And so that was an important thing for us. And so we really thought about this as a group and said, well, really from our perspective, what do we need to know? And one of the things we need to know is how effective is this whole kind of process in terms of engaging communities, getting communities to, develop community plans. What's our role within this? What's CDPAC's role? What's CPAC's role? And really trying to get an assessment and kind of a much kind of higher level type of evaluation about how processes are working and doing that. We do that more on the front end. We also were very interested in terms of evaluating how it works in communities where we see, really some communities take hold of different initiatives and they just fly. And then in other communities, we see much more limited success or much more requirements from us to help some of these projects work. And it's just an interesting thing. So what works at the community level where we see, such tremendous uptake, and then in other places, limited things. So is it a community champion? Is it support from chief and council? Is it more a population type of thing? And so all these things, we're basically trying to understand that a bit more effectively as well, especially now with working with 9 communities and very different kind of populations and in different parts of the country. Some of this information is proving quite interesting for us. And then finally, which is probably the most obvious, but, again, it's the project deliverable in terms of, so if we are trying to improve food access and food quality, what's happening? Is this actually changing? Are we seeing dietary change? Are we seeing any type of behavioral change? Are we seeing increased food access? What type of food changes? Who's getting it? And so, but these are all the 3 areas that we've been focusing on for the most part in terms of our group. If we go to the next slide, so the types of tools, well, again, this is one of the issues with this particular project is that, when we were working in Northern Ontario, most of our time would be up in the communities and just simply that's where we would do really, be there doing hands-on work and working directly with people. We would be the ones that would be doing interviews. We were the ones that were, if we were going to be doing surveys or whatever, we were the ones that were going to be doing it on the ground. But now with 9 communities, it just simply it's not feasible from an economic perspective. The grant money is just not enough grant money to do that. It's super expensive to get to the communities to begin with and now across the country. So we've done a couple things. One, we've actually have asked the community members themselves to take the lead on the evaluation. So they're the ones that are kind of reporting back to us. And so each community has someone who's ultimately responsible for managing the evaluation at the community level. We are still doing survey and questionnaires. We've done these in a very different way, though. Initially, we tried doing them as a web-based activity, but it wasn't very successful. So we've been doing almost like a semi-structured kind of questionnaire that we actually would do one-on-one with people over phone. And then we have them administered with community local coordinators who actually go almost like on a face-to-face basis with various people. And again, this is a very different, type of evaluation, and in terms of bias and in terms of methods. They're hugely problematic. But it's also the reality is just simply if we don't do it, we simply won't get any information. What we find most effective, though, is still the in-person interviewing, and we've been doing this primarily through phone. It's quite exhaustive in terms of trying to get a hold of everyone and getting time to sit with people on phone. But it's been the most effective way. And we find with communities, the sit and chat approach is just generally, I think it's more conducive in terms of Indigenous practices, in terms of Indigenous methodologies, but also in terms of just local practices, in terms of conversation. And we find that much more effective. So this combination, kind of mixed method approach, is what we've been doing with somewhat limited success in certain areas and to a certain extent more success in others. So if we go to the next slide, I'll just quickly go over this one because, again, it's just kind of where we're targeting. So, we've talked to a certain extent with people at the project team stakeholder analysis, which is really at the, individual and group interviews with resource providers and local coordinators. So really at the top level, which is really, again, most of our time and conversations are with people who are the community champions, who are really the ones responsible for any of the successes in the communities. And we really we're very dependent on them to get this information. And more level 2 was kind of the community leaders, again, project champions, but then speaking with community residents with kind of a focus group approach, which again, our community champions are the ones that are responsible for making this happen. And so, but again, trying to understand a bit more about the actual project outcomes. And then finally, the third level is more of a kind of quantitative measure, which we find are quite useful, which is just really basic numbers about the amount of yields that are coming in. If people are focusing very much on bringing food into the community, well, we're actually getting people to count the amount of food that comes in, where the food's going, where it's being distributed, and how many kids are being, how many participants, how many trips. And it's just, it's a nice way of knowing, even, for example, community fees. So how many fees were held, what types of food were served. And so it's just, again, it's a bit more concrete in terms of some of the information that we can get back to the funders. So we'll just go to the last slide. And what we have here really is this is the first kind of chunk of about 5 pages of text that we've been able to try to organize, because a lot of the evaluation that we get is really presented to us in narrative form, long with lots of pictures, lots of stories, trying to capture what it means for kids to get on the land, the types of food. For example, even things like Facebook commentary, where people are saying, we've had fresh strawberries for the first time. These are things that we're trying to bring into the evaluation and reporting back to the funders. And so you can see the different levels in terms of, if you go to the final column in terms of the evaluation measures, you can see that we've provided some narrative in the first part of it. We've provided some survey reporting, so you see how many participants, but each trying to deal with these project goals, the 5 project goals that we have for this. And I see that I'm kind of pretty well out of time, but I just wanted to kind of show you a little bit how we're trying to organize this. It's, again, what funders don't want to see is the 50 pages of reporting that we do get with lots of pictures, and it's easy to present, but not easy to report on. So this has kind of been our task about how do we synthesize this and give it in a way that basically makes sense to the funder. So I guess that's it for me, I suppose. So I just want to thank, again, anyone for, I should thank everyone for listening and for inviting me to this session. And I look forward to conversation towards the end.
Great.